Teaching Physical Education in Primary Schools, The Health-Based Approach by Rebecca Mead. Physical education aims to provide experiences that teach students to understand the importance of healthy living. Students develop a broad array of movement, personal and social skills with the knowledge, motivation and confidence to engage in physical activity throughout their lives. Health-based physical education aims to facilitate the development of the knowledge, skills and understanding needed to make informed, health-conscious decisions. Alfrey, Webb and Kale, 2012, define health-related exercise as physical activity associated with health enhancement. The ultimate goal of health-related exercise is the promotion of a healthy lifestyle, with students gaining the ability to make health-wise choices which lead to continued physical activity engagement in their adult lives. Health-related exercise should have a focus on inclusion and encourage participation in a variety of sport, dance, fitness and recreation activities, with an emphasis on wellness. Learning should take place in and through non-competitive physical activities, catering for the diverse range of learning styles and personal interests in students. There are many benefits to using the health-based approach in physical education. With a strong focus on health prevention, physical activity in children can aid in combating the prevalence of type 2 diabetes, obesity, fatty liver conditions, coronary heart disease, and other serious medical conditions. The health-related exercise focus in physical education can aid in the development of necessary skills to lead an active, healthy lifestyle. By combining physical activity, movement skills, confidence and nutrition, students can learn how to become disciplined and manage their own well-being. Developing healthy lifestyles can motivate children to make wiser choices and remain physically active into adulthood. The ideal health-based physical education program contrasts with the competitive environment of elite sports. Students are given the opportunity to explore their own interests and learn a broad range of skills without the pressure to perform. The nature of competitive sports can promote the extension of already competent students whilst alienating students who are less skilled or less confident. By focusing on participation and individualising tasks to cater to each learner's needs, the strengths-based approach in health-related exercise provides a less stressful, inclusive opportunity to develop physical competence and confidence. As with any model, there are limitations with the health-based approach to teaching physical education. There is a lot of pressure on physical educators to solve the current obesity crisis in children. No matter what approach is adopted, physical education alone cannot eradicate these concerns. There are many factors contributing to childhood obesity, including personal, family, society and community influences. Victorian primary schools are required to provide between 1.5 and 3 hours of physical education and sport each week. Unless students have healthy role models at home, improvement in student health is unlikely. The drive to achieve the ideal physique can lead to a loss of self-esteem and experiences of humiliation in students that do not live up to their own expectations. For many individuals, such pursuits are unattainable. There is a phenomenon known as the health-related exercise conundrum. Teachers bring their own philosophies and experiences to their teaching. Unfortunately, this can lead to a narrow understanding of health-related exercise. Teachers often focus on competitive sports and fitness ideologies as they teach what they know. In a study by Alfrey, Webb and Kale, 70% of physical education teachers had not taken part in professional development for health-based physical education in the last 3 years. Teachers need to continue learning and refining their skills in order to replace their dominant ideologies and misconceptions and engage with the health-related exercise approach. These limitations are a result of improper health-related exercise teaching rather than the inadequacy of the approach in physical education. In order to successfully implement the health-related exercise approach in primary schools, there needs to be a whole school commitment. Physical education programs need to be engaging, inclusive, and encourage participation. Teachers should give students mini breaks during class with activities which increase daily physical activity and engagement. The school should actively promote healthy living with informational posters, nutritional education, and relevant incursions. Students should be encouraged to be active during recess and lunch through the use of structured games and activities. Extracurricular sports should be made available to increase physical activity outside of school hours. Increasing the duration or regularity of health-based physical education without improving practices will not increase student engagement. If a child has negative feelings towards physical activity, more mandated time can further reduce enjoyment. The teacher-centred sport and skill-based focus should be avoided with an emphasis on the following: a high level of physical activity with moderate to vigorous movement activities most of the time. Encourage full participation and inclusion by providing a variety of activities to cater for student interests, including sport, dance, games, recreational and fitness activities. Differentiate movement activities to cater for different learning styles and skill levels in students. Ensure pre-service physical education teachers develop their pedagogical content knowledge. Ensure physical education teachers live what they teach and remain active role models for students. Teachers should undergo regular professional development to ensure curriculum goals for student achievement are being met. It is vital that teachers of physical education are committed, passionate, and knowledgeable. Assessment should be formative rather than summative in nature. Fitness and skill tests should be replaced with ongoing assessment of student health-based choices and participation in physical activity. Learning can be displayed through improved movement competence and confidence. The health-based approach encourages participation in physical activity and the acquisition of skills to develop healthy habits in everyday life. If taught effectively, focusing on student health and fitness can provide support towards improving the health of children.